Hi, my name is Dr. Surakshith Battina and I'm an endoscopic surgeon and a reproductive medicine specialist working at Indigo Womens Center, Chennai. And today I want to give you a brief overview about oocyte freezing, whether you are a right candidate or not for this particular program. Current birth statistics show that women are delaying their childbirths to much later, and this is mostly because women are pursuing higher degrees in post-graduation. They are also looking at better benefits in their professional life, and all this requires time and effort. Now this is fine until she delays it to maybe 28 or 29 years of age, but the more she delays it, like after 35 years of age, the fertility potential drops down drastically. This is because when at birth, the woman is having around 7 billion follicles. All of this comes to around 200,000 when she attains puberty, and the time when she is around 51 years of age, there are only about 1,000 follicles left. So the good point about all of this is that only the ovaries tend to age, which means that after a particular point of time the number of follicles reduce, and as the number of follicles keep reducing, the quality of the oocyte also comes down. But this isn't the same for the uterus. The uterus as such never always has its quality. The woman will be able to bear a child at any point of time with no issues at all. And this is the only reason why oocyte cryopreservation and embryo cryopreservation have become such sought-out treatments today. There are no negative effects to embryo cryopreservation, and there have been instances where the patient has had a pregnancy after 20 years of egg or embryo cryopreservation, which means the woman had her embryo cryopreserved when she was around 20 years, and when she was 40 she had the embryo transferred. And the live birth rate of a cryopreserved embryo or a cryopreserved oocyte only depends on one thing. It's the time when the woman gets her embryos or eggs cryopreserved. So the earlier the better. Who are considered ideal candidates for embryo or oocyte cryopreservation? 1. Women who are undergoing cancer treatment, either they're having chemo or radiotherapy. 2. Women who are undergoing surgery which might damage the ovaries or the follicles. 3. Patients who are prone to premature ovarian failure. 4. Any kind of ovarian disease which is known to cause ovarian damage, like endometriosis. Or 5. Patients who want to delay their childbearing either because of personal or professional reasons. So what is the process involved, or how does this happen? The first initial step is to do the investigations to make sure that you have enough number of follicles. For that we do something called as the folliculometry. This is done by a regular ultrasound scan, and this will give us an idea of total number of oocytes which are available for us to collect. 2. We do a blood test called as the AMH or the anti-Mullerian hormone, and this will give us a basic idea of what is the quality and the number of oocytes which can be retrieved. The other blood tests we do are the basic hormone profile to make sure that everything is under control. So the next step is called as the ovarian hyperstimulation. In this process, we inject the patient with FSH, which is the follicle stimulating hormone, and these injections help in developing not one but several oocytes. So usually in every menstrual cycle, a woman is having a tendency of having one mature oocyte, but once we start injecting the woman with FSH, she tends to have maybe around 10 to 12 oocytes which are developing at the same time. This also depends on her age. If she's younger, she tends to have more number of follicles. If she is much older, she tends to have lesser number of follicles. We do day by day ultrasound monitoring for the patient to make sure the follicles are growing in size as we keep giving them the FSH injections. And once the oocyte becomes mature, that is, it has become 2 into 2 centimeters, we give an injection of a trigger which is called as the HCG or human chorionic gonadotrophin. The next step is called as a oocyte collection. We give the patient anesthesia, which means she is sedated, and at that point of time we go ahead and pass a needle inside each of these ovaries and suck out all of the follicles. Once we retrieve all of these oocytes outside the human body through the process of egg collection, we have two options. Either one, we can freeze all the oocytes by themselves, or we can make them into embryos, which means we take another sperm, we inject it directly inside the ovary, and then we make it into a embryo and then we freeze them. So you would ask me, why would I want to freeze it as an embryo and not just as an oocyte? The only reason why you would like to freeze it as an embryo and not as an oocyte is because when you freeze them as oocytes, you have a chance of losing around 50% of oocytes when we unfreeze them. But embryos, when we unfreeze them, we only lose around 20%. So I would sincerely recommend any woman who is planning to delay her childbirth to definitely undergo oocyte cryopreservation, because this is a very good and proven method, and we have a lot of women coming into our hospital to undergo this procedure. It is not a taboo anymore, and definitely when the technology is available, it has to be used. So I hope you found this video useful. If you need more information, you know where to contact me. So until the next one, guys, take care. Bye bye.